Hello everybody, my name is Evdokia Ioannidou. I am a postgraduate student in the University of South Wales in the major of diabetes. Today we are going to talk about microvascular disease and diabetes, and I would like to inform you and bring awareness to this specific theme due to the miscommunication that is provided to us via social media. I would like to enlighten you guys and hope you will learn something throughout this YouTube video. So, what are microvascular complications? Microvascular complications are chronic complications that impact the small blood vessels. Common examples of this complication include retinopathy, nephropathy, and neuropathy. Within the illustrator provided below, we are presented with a comprehensive portrayal of the distinct categories between both macro and microvascular complications arising from the presence of diabetes. As we can see in the macro categories, we have cardiovascular diseases, cerebrovascular diseases, and peripheral artery diseases, whereas in microvascular categories we have retinopathy, neuropathy, and nephropathy. So to begin with, let's talk about retinopathy. It is a common eye disease that leads to blindness. It is mainly caused by not controlled diabetes, and those in risk are diabetic patients, either type 1 or type 2, or any type of diabetes, gestational diabetes, MODY diabetes, patients that have longer duration of the disease, the ones that have diabetes but also have uncontrolled blood pressure, high cholesterol levels, and the ones who are smoking, and some ethnicities like African Americans, Hispanic, and Latinos. And so, diabetic retinopathy is classified. So let's see the classification of diabetic retinopathy. In the green space, we can see the retina. Here, the retina is well, and it's a retina with no presence of a disease. There is a small damage to the retina, which is called mild non-proliferative diabetic retinopathy, also known as NPDR. Here we have localized swelling of the retina in the small vessels of the retina, also known as microaneurysm. Then when more damage is being done, we have moderate NPDR. We have small bleeds, as we see, small dots in the picture provided to us, and blots of hemorrhages, leaks, or closure. Then we continue to severe NPDR, where we have more damage to the blood vessels, more interretinal hemorrhages, venous bleeding, and intraretinal microvascular abnormalities. And as we get closer and closer to the retina being more damaged, the final stage of diabetic retinopathy, where here the new vessels form in the retina. We have here hemorrhages, and the retina might detach. What is the management now of retinopathy? Regular eye examinations. We have to see if we have diabetes, we have to make sure that we see an ophthalmician and have regular checkups. Maintain blood sugar levels under control, lower our blood pressure if our blood pressure is more than 120 to 80 mmHg, lower our levels of cholesterol if our cholesterol is elevated, quit smoking, and staying active. Also, I would like to tell you guys The importance of following a healthy meal plan. How is diabetic neuropathy diagnosed? By routine testing as a management of diabetes, which is provided by the healthcare professionals, and it is advised for diabetic type 1 patients to begin screening for nephropathy after 5 years of their diagnosis. Whereas in type 2 diabetic patients, the diagnosis might begin when the patient is diagnosed with diabetes. In diabetic nephropathy, we have progressive kidney damage. We have increased levels of albuminuria and decreased levels of glomerular filtration rate. We also have high blood pressure, which associates with excess morbidity and mortality from cardiovascular complications. It is less common in type 1 patients, whereas 3% of the newly diagnosed in type 2 diabetes are more likely to have it, that are listed below. So for example, if a patient comes with a GFR at 60, we can see in the green color that the patient is at low risk of developing kidney disease. Whereas if a patient comes with an albuminuria rate at less than 30 or at 30 and with a GFR of 15, we can see that the color changes in red. So here the patient, we can see that his severity to develop diabetic kidney disease. Another microvascular complication of diabetes is diabetic neuropathy. Diabetic neuropathy is a nerve damage caused by diabetes, affecting the nerves in the feet, organs and muscles. Nerves transmit messages between the brain and the body, enabling functions in the sight, hearing, movement, and organ regulation. This damage can lead to significant complications in the individuals with type 1, type 2, gestational diabetes, or any type of diabetes. Diabetic neuropathy has 4 categories. Category number 1, we have peripheral neuropathy. In this one, we have numbness, tingling, burning, and pain. In category number 2 is autonomic neuropathy. In here, we have a feeling of full after small meals, vomiting, nausea, and diarrhea, constipation, and bloating. Number 3 of category of diabetic neuropathy is a proximal neuropathy. In here, patients have weakness in the thighs, buttocks, and pain in the hips, buttocks, and thighs. To finish with diabetic neuropathy, we have the final category, which is mononephropathy. In here, we have eye pain, double vision, chest or belly pain, severe back pains, and paralysis on one side of the face, also known as Bell's palsy. What are the complications of diabetic neuropathy? We have loss of sensation, sexual dysfunction, increased or decreased sweating, toe infection and amputation, urinary tract infections, low blood pressure, and loss of sensation. How can we prevent diabetic neuropathy? First off, I would like to tell you guys about the importance of finding the correct shoes you have to wear. So you need to be able to find a shoe that fits properly to your feet. Take care of your toenails, visit the salon every now and then, or go to a podologist. Use lotion on your feet or to reduce the dryness of the feet. Check your feet and legs daily for any scratches or any open wounds. Avoid standing too long for a long period of time, and do not walk barefoot, especially in the summer where the sun is out and it's too To sum up, I would like to tell you a summary of the microvascular disease related to diabetes. So, we have retinopathy. Some of the features of retinopathy are muscular edema, retinal detachment, hemorrhages, and exudates. How can we prevent it? By regular and yearly screening for the purpose of identifying and treating medical conditions with a particular focus on closely managing blood sugar levels. We have nephropathy, which is the leading cause of advanced kidney disease in the United States, and it is characterized by the earliest indicator known as microalbuminuria. To prevent nephropathy, we have to manage our blood sugar levels to be under target. Closing with neuropathy. In here we have the peripheral or autonomic. Peripheral contains increased vulnerability to the food, euclirs, pain, tingling, and numbness. In autonomic, neuropathy affects the cardiovascular, gastrointestinal, and genitourinary system, as well as the ability to perceive hypoglycemia. How can we prevent neuropathy? We have to visit our healthcare professional, and our healthcare professional has to take a close look to our feet. Also, another important factor that I would like to mention is that all of these microvascular disease need closely monitor of blood glucose to be within targeted limits given by our guidelines. I would like to thank you for watching this video, and I hope you learned something today.